So I want to talk about what I call the evolution of lower eyelid blepharoplasty. A lot of you have heard, seen me post patients. We call it the trifecta lift. And I want to talk a little bit about how that came to be. Basically, lower eyelid blepharoplasty used to be about removing this fat pocket that's on the lower eyelids. And the way it used to be done, a big incision was placed underneath the eyelid on the outside skin. And then that incision allowed the surgeon to go through the muscle and then expose the fat pads and remove them. And this technique actually is something that some plastic surgeons still use. And the problem with it was that you had to go through a big incision to get to the fat pads, and you would remove the fat pads, and subsequent to that, the patients usually ended up being very hollow, and the recovery time was much longer. So about 20 years ago, newer techniques came where instead of making an incision on the outside, we would make an incision on the inside of the eyelid to allow getting access to the fat pads. The idea is still that there was still a problem with that, because as they did that, they removed some fat, and removal of too much fat led to the problems we see today that are hollowness. So patients who long time ago have had blepharoplasty, if too much fat was removed, you see as they got older, they even looked older. With time, we figured that, it's probably not a good idea to remove fat, and we want to transposition it or recontour it is what I usually do. So fat removal is much less than what it used to be. About 15 years ago, one of the things that I started noticing that really helped my patients was that it's not just the eyelid. When we look at the eyelids, lower eyelid area, it's a combination of things. Usually it's because there is this fat that's herniated, so that's number one. Number two is that there is an associated mid-face volume loss. And that leads to some of the things we see with the aging. And number three is that the skin, as we get older, gets thinner. So these three components are what we address in the trifecta procedure. So lower eyelid blepharoplasty, and again, this is not a cookie cutter approach. We go from the inside of the eyelid, recontour and reposition the fat pads. And number two, injection of autologous fat, which is the patient's own fat, into the mid-face area. And a lot of times if I need to, I revolumize the temples. If I need to, we revolumize the nasolabial folds. So depending on the patient, we revolumize that. And number three, if they are a candidate, we CO2 laser them. Now, CO2 is for fine lines and skins. Again, it has to do with the patient's skin. And typically speaking, if they're not a CO2 candidate, we either do an internal tightening, which is a technique I have, or take a little pinch of skin off. Basically, this is the evolution of what I think rejuvenation of lower eyelids should be. It's not just, okay, I'm gonna have a blepharoplasty where fat is removed. The incisions are much smaller, they're on the inside. Again, when I first started, just to go back to that incision, I used to make a big incision on the inside of the eyelid, which had to be resutured. I don't do that anymore. The incision is so small that I don't have to suture it. And a lot of times you see patients a week out or 2 weeks out and they look like nothing was done. And the reason for it is because of the approaches how this technique has evolved to be what it is. I hope this helps. Please let us know if you have any questions on the comments below. Thank you.